For information and entertainment purposes only, not intended to be construed as medical advice. Consult your provider.
Overall, how do you think that medications can support long-term weight maintenance?
For me, it's a choice. Do I want my patient to take these antihypertensives forever, or do I want to give them something to help them lose weight? And perhaps they may not
Interesting.
even need to take the antihypertensive anymore.
Right.
I think
Interesting.
obesity is such a big problem in the United States that the weight loss medication, it has a role. Like, do I think it's going to resolve our issue with weight loss? No, I think it's a multifactorial problem, and I think this helps some people.
Mm-hmm.
But
Mm-hmm.
ultimately, I mean, diet is important, exercise is important, but there are some patients, regardless of how much, they work on their diet, how much they exercise, they they can't,
They just can't.
they just can't.
Without some medical
Right.
intervention. Yeah.
So it's great for those patients.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Sayla, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Today is going to be so interesting. We are talking about post-bariatric surgery and body contouring. So what you can do after you've had bariatric surgery.
Yeah, and I feel like there's so many people out there who talk about having excess skin, and while they are more familiar with the procedures that get you to that, they'd like to be more informed about how to get rid of that excess skin. So joining us to discuss that, our expert is a double board certified plastic surgeon who's based in Atlanta, Nip and Tuck in Atlanta. He's the founder of that, and his name is Dr. Nicholas Jones. We are so excited to be welcoming him to Care Experts to discuss this.
Yes, let's bring him in.
Dr. Nicholas Jones joining us today. Welcome, Dr. Jones.
Thanks for having me.
Thank you for being here. And today we are talking about post-bariatric surgery and weight loss medication. And you are our expert in that.
Yeah, you're double board certified as a plastic surgeon and the founder of Nip and Tuck, which is based in Atlanta, right?
Yes, yes. So I started my own practice about 4 years ago. I'm originally from New Orleans, and the main reason I started my practice was I wanted to have something that was just focused on patients and just provide them with the best possible experience without compromising their safety.
Which I'm sure is a passion that has driven you for, I guess, the last 20 plus years now that you've been in plastic surgery?
Yes, it's a long journey. So just growing up, my mom constantly told me she used to tell me I was going to be a doctor on those drives to school, and obviously you hear the same thing over and over again, and then people naturally, when they ask you what you want to be, of course I said doctor, and then over time that's just where I ended up.
I don't think you just end up there.
I
though. I
know,
mean,
yeah.
and to be a plastic surgeon is a specialty. Like, you decided that you were capable of pursuing that, went after it, attained it, and now have your own practice in Atlanta. That is to be applauded. Why did you decide to lean into it?
So I was always really competitive. I was small. They used to call me Peanut. I played basketball, and I never forget it. I had a assistant coach when I told him I was going to be a plastic surgeon. He laughed at me, told me I should pick up a trade, and by me being so competitive, I think that took me to another level. And once I got into medical school, it was always plastic surgery for me. But a lot of times when you select a specialty, you end up selecting a specialty based on the people around you, like you, who you find yourself most like. And for me, it was plastic surgery, and there's actually breast reconstruction. I had a very natural connection to them. And then with plastic surgery, I feel like the efforts of your results, you can see immediately. The patients aren't sick, and you can kind of curtail your practice into whatever it is you want. You can also have a business at the same time. Yeah.
It's more of a lifestyle, it sounds like,
Yeah.
too. Yeah.
Uh-huh.
And it's also kind of an art and a science, right? Would you say?
Absolutely. I always tell people I'm big into cosmetology, like hairstyles. Like if you go to one hairstylist and let's say you want a bob and you went to 20 different stylists, you get 20 different cuts. And
100%,
it's kind of
especially in Atlanta.
it's the kind of same thing with plastic surgery. Everybody kind of does things unique.
Would you say that one of your areas of expertise is bariatric surgery?
So not bariatric surgery per se, it's
Post?
post-bariatric surgery. So
Right.
Explain that to me.
yeah, so bariatric surgery is a weight loss operation.
Right.
So typically it involves some sort of restriction and malabsorption. So they're either making the stomach smaller or rerouting how your body absorbs food. And so once they lose the weight, they become stable. They come to someone like myself, plastic surgeon, because they usually have excess skin. And the excess skin can be troublesome for lots of reasons: appearance, functional, infection, and they just want to look better. And then that's when I come in to just kind of recontour their bodies.
To nip and tuck.
Nip
There you
and
go.
tuck.
Oh, I like
Yes.
what you did there. What's involved in post-bariatric surgery when someone comes to you?
Right. So usually it's after they've stabilized. So, you know, some of these people lose anywhere from 80 to 120 pounds or even
Wow.
more. And so if you can imagine if, you know, they're a lot bigger and then they've pretty much shrunk. But now they've lost some of their skin elasticity. And so now they just have loose skin all over the place. Typically it's in the trunk, the arms. And so once the weight is stabilized, and usually that takes anywhere from 6 months to a year, weight stable, assess them, find out what's troubling them. And for the most part, if they want like a full body makeover, we can't do it in one operation. It's usually staged. So we figure out the best approach, what's bothering them most, their priority, and then we get it started.
So you would start in one area, like the abdomen, and then move on. How long in between the?
So it really depends. Like it really depends on the combination. Like for example, I would never do arms and the legs together because they'll be immobile. So you do something like that, they're at a higher risk for DVTs or blood clots
Right.
because they're not moving around enough.
Okay.
And so other thing you have to take in consideration, underlying medical conditions, the length of the procedure, and how much time they have available and who's going to be taking care of them. So typically for me, 6 hours, I won't, if I can't do it in 6 hours, then they probably need to have it staged.
Oh, wow.
Who's a good candidate for post-bariatric surgery?
Okay, so that's a great question. Anyone who, I mean, in good health.
What do you do? How do you determine good health? What is
Good
that?
health meaning if you, I mean, if you can imagine, most of these patients have some sort of underlying comorbidity, whether it's hypertension and diabetes, but typically after the weight loss, the diabetes is resolved, the hypertension's either gone or is better controlled. And so patients who are in normal health or if they have comorbidities, they are controlled. And so they're controlled, I assess them, their weight is stabilized, and if as long as I feel like I can meet their expectation and I can do it safely, then we can do surgery.
That's great. And then if you did do one area, let's say you could do it within 6 hours, how long do they have to wait until they can do the next area?
Great question. Usually about 3 to 6 months.
Okay.
Because you want your body, give your body some time to heal. And also there's inflammatory processes going on. And so if you don't give them enough time, you take them back to the OR, they're at a risk again for complications. The biggest concern would be DVTs,
Blood
which is the
clots.
blood clot.
Okay.
Yes.
So you have a double board certification in plastic surgery. What does that mean exactly?
Right. That's a great question. Double board certified, meaning I completed specialty training in two specialties. I first completed general surgery, which is 5 years, and then I did plastic surgery, which is another 3 years.
You were in school a lot.
He's passionate. He was dedicated.
A
His
long
mama told him he
time.
was going to be a
A
doctor. He's like,
long
well, I'm not going
time.
to be a
Yeah.
doctor. I'm going to be like one of the best.
Yeah.
Right.
Yeah.
And so
I'm not going to be Peanut anymore.
most
Yeah.
people use that as like a marketing tool. It's kind of like a
Sure.
marketing tool.
It sounds really good.
Yeah.
Yeah, it doesn't sound good.
Yeah.
Like if I was triple board certified, wouldn't that sound good?
Yes.
Well, he's only
Yeah.
double, and
Yeah.
you're triple.
Oh,
I'm going with
yeah.
you. Yeah.
What I think I got out of it is a lot of doctors, they may not have as extensive training.
Mm-hmm.
And so if you're double board certified, the general surgery, I feel like I can take care of patients. I'm more comfortable dealing with complications
If
as
something were to happen.
as opposed to someone who completed plastic surgery
Mm-hmm.
residency. They don't have as extensive amount of training in other specialties or just the general surgery part, like the trauma intensive, the ICU, the critical care, just dealing with problems. I think I'm more abreast of taking care of
You've
complications.
seen a lot more fires happen.
Yeah, I think it just makes you mature. I think it just makes you a better doctor. That's all.
Yeah.
After someone has had bariatric surgery and they come to you for their post-bariatric surgery, why is there so much excess skin and why does the skin lose its elasticity?
Great question. So, lots of reasons. So, for one, it's a rapid. They've lost a large amount of weight in a fast time. It's just really fast. So your body hasn't had, or your skin hasn't had enough time to adapt to the rapid weight loss. So let's say if you're losing the weight over a more controlled period of time, your skin can adapt. But as you age, you lose elasticity, your collagen, you lose your collagen deposits, and then also with the rapid weight loss, you have nutritional deficits like your vitamin deficiencies, malabsorption. So your body just isn't functioning the same. And so, and then you also lose some muscle mass. So that all leads to the excess skin.
Okay.
But certainly post-bariatric surgery is not a quick fix, especially if there are multiple areas that you need to tend to as a surgeon.
Absolutely not. Right.
And
Yeah.
what does that timeline look like for somebody? Let's say there are two areas of concern, perhaps the trunk area and the arms, and you've already explained that there is a certain amount of time that they'll have to wait between those surgeries. Give me a time frame or a timeline for what someone could expect to see
So-
their optimal results.
Okay, yeah, great question. So, for someone who's dealing with a trunk in the arms, oftentimes I can combine those two procedures. But let's say we combine those two procedures, do the surgery. I usually recommend that patients give themselves at least about 6 to 8 weeks to completely recover. And when I say completely recover, at 6 to 8 week point, you can resume all your normal activities. That's heavy lifting, travel. And when I say travel, I always tell them give yourself about a 6 to 8 week window. And if you plan a vacation or you plan on going somewhere, you can fully enjoy that trip. You won't have any restrictions. Because usually at that point, if you haven't had complications, you're not gonna have them at that time. And also all of the swelling, your body's completely healed, and you can resume a normal life.
Oh, that's great. Can you talk about also the types of body contouring procedures that are available? Circumferential body lifts?
Right, circumferential body lift, that's a common one, but let's start with like a really basic one. So abdominoplasty or tummy tuck. Usually when patients lose a lot of weight, they're going to have some sort of truncal or loose skin of the abdomen. It's called a pannus. And so it's usually, we address that with a tummy tuck or abdominoplasty, which is a lower abdominal incision, lift up the loose skin, tighten up the abdominal wall, the muscles. So your rectus, your ab muscles, like if you've having kids, those muscles separate. So part of the procedure is putting the muscle back together. So we repair that and get rid of the loose skin. Now, a circumferential body lift. So not often, sometimes patients have excess skin all the way around and things just begin to droop. And so circumferential body lift addresses the lower back and it helps lift the butt up and it also gets rid of the excess skin. The excess skin, it's not always limited to the anterior or the front of
True.
your body.
Yeah.
Yeah.
It goes all the way around. So by doing circumferential, we're able to
Ooh.
contour the waist, like take everything in.
Yes.
So that's a common procedure. Brachioplasty, that's getting rid of the loose skin of the arm. Sometimes they have loose skin of the back, the upper back, and that's a back lift. And then also, I mean, face lifts, neck lifts.
Do you do those too with the excess skin there?
Yeah, yeah.
Wow.
So
Okay.
yeah, you can. I mean, it can affect all of your body, and it just really depends. A lot of it depends on your genetic makeup, how much weight you've lost, and where you started. So some people, I mean, they may not have any evidence of or loss of elasticity of their face. It may just be limited to their breasts or
Right.
their abdomen.
Is there an overall body lift surgery? Like if everything has drooped,
Right.
can you pull it all right back up?
So yeah, you can address like the whole body, but again, that's not something you want to do all at once because the longer you're under anesthesia, the more likely you are to have a complication. Like it's just a long surgery can lead to puts you at a higher risk for
You
complications.
said your max was 6 hours.
I mean,
It's a long surgery
I'll,
anyway.
I'll go over six sometimes, depending on the health of the patient.
Sure.
If it's a healthy patient, sometimes I'll go over, but the other thing you have to take into account with bariatric patients, so when they were heavy, in order to meet the body's energy needs, the blood vessels they get bigger, they're engorged. And so when they lose the weight, those vessels are still large. So they're at a higher risk of having bleeding during the surgery. The vessel, like I said, the vessels are larger. And then also with the weight loss, especially the surgical weight loss, their body their bodies doesn't they don't absorb nutrients the way a normal person bodies does. So healing can take a lot longer. And that's just been my experience with bariatric patients. Like for whatever reason, sometimes it just takes them a little bit longer to recover.
And during that recovery process, what are some of the factors nutritionally that they should be considering, patients should be considering?
So they need to make sure they're consuming enough protein, make sure they stay hydrated, and then if their bariatric surgeon or their primary care doctor had them on some sort of supplements, they need to continue using those supplements.
You talked about not wanting to, well, not wanting to, that it not being safe to do all these procedures all at once. I feel like we live in a time where everybody expects instant gratification, or they go on social media and they say, I want to look like this. How do you help your patients set realistic expectations?
Right. So I just really have a conversation with them. I try to meet them. We have to have a common ground. So we talk. I try to figure out what their needs are, what their desires are. And if we can't have a realistic conversation, I can't do that. So we have to be realistic. And so if we can't be realistic and I don't feel like I can meet their expectation, I'm probably not the surgeon for them. But sometimes even after bariatric surgery, they may need to lose some more weight.
Really?
And
Before coming to see you.
Before coming
before
to do
having
it.
surgery, right? Yeah, so we can either use some medications or I can have them go back and see their bariatric surgeon, their provider, and see if there's something else that can be done.
Wow.
Yeah, because everyone's not a candidate for surgery.
Right.
Who isn't? Who is not a good candidate?
A poor candidate would be someone who has the comorbidities, like if their hypertension is uncontrolled, if they've had a history of a pulmonary embolism, if they have any sort of blood dyscrasias, such as or blood abnormalities such as sickle cell disease, recent stroke, heart attack. Um,
You need to be in good overall health,
you
is what you're
you
saying.
need to
Yeah, because there are a
you
lot
need
of risks involved.
What are some of the impacts of some of these body lift procedures, like the lower body lift versus the upper body lift? Can you talk about the different results someone could expect?
Right. So for the lower body lift, it's essentially lifting, like if you have laxity of your lower body, it's reshaping your butt. Like if you have laxity there, it's going to get rid of the excess skin and it's going to take your waist in. It also helps with your thighs. It's just repositioning. It's just lifting everything up, just restoring what you look
Tightening
like.
it.
Yeah,
Okay.
tightening and lifting. But the upper back lift is exclusively if you've ever seen someone with bra rolls or excess skin of
Right.
their upper back, it's to get rid of the laxity there. Now,
Oh,
Okay.
I
I didn't even know you
personally
could get rid of
I
that.
didn't
I
either.
personally am not a big fan of that surgery because it leaves a visible scar.
Okay.
Now with the lower body lift, the circumferential body lift, when they have on clothes, it may not be. I mean, you can put on a bathing suit and that can be hidden, but the
Wow.
scar across your back, it's a
Is
sign.
that one a big one across
It's
there?
a clear sign that you've had surgery.
Right.
Right.
Does it go all the way across the
It
back?
does. It does. Yeah.
Okay.
What are some of the benefits that you've seen from your patients who have achieved those optimal results as far as how it's changed their lives?
I would say the number one benefit or what I've seen is confidence, restoring confidence so that you can go back and be a functional member of society, be the best version of yourself, and continue with your life. I mean, I mean, for a lot of these patients, they've been, heavy for a really long time. And now that they've addressed that, they've had the surgery or they've taken the medication and they've got their weight down. And now they look in the mirror and they have all this loose skin, this redundancy of skin. It itches, they sweat, they can't fit their clothes properly. And now we've done the surgery and now the clothes fit.
That's
I
amazing.
mean, just being able to put on a belt or being able to see your belly button. Like for some patients, that's enough.
It's life changing. Well, and to
Yeah.
think you went through this whole surgery, bariatric
Right.
surgery, and now you have all this, it's a little depressing. So then to do this,
Right.
it must be life changing.
Yeah.
Restorative for sure.
Restorative,
Yeah.
yeah.
And I feel like for you as a surgeon, I mean, obviously you're working on the outside, but the work that you're doing on the outside of the body is having such a tremendous impact. So, you know what we've been hearing a lot about, Dr. Jones? And when I say we in society, so much about these weight loss medications
Yeah.
or being used as weight loss medications, although they weren't necessarily intended for that in the beginning. Let's talk about that, right? Overall, how do you think that medications can support long-term weight maintenance?
I think it's a great option for the right patient. It's just it's a choice. So either way, in my mind, this is how I approach it. And it's interesting because some doctors, like a lot of primary care, I have patients who go to their primary care doctor and they won't give them the weight loss medication. But for me, it's a choice. Do I want my patient to take these antihypertensives forever, or do I want to give them something to help them lose weight? And perhaps they may
Interesting.
not even need to take the antihypertensive anymore.
Right.
I
I
thought
think
about it
I
that
hadn't
way.
either. That's
I
so
I
interesting.
think obesity is such a big problem in the United States that the weight loss medication it has a role. Like, do I think it's going to resolve our issue with weight loss? No, I think it's a multifactorial problem, and I think this helps some people. But ultimately, I mean, diet is important, exercise is important, but there are some patients, regardless of how much, they work on their diet, how much they exercise, they they can't,
They just can't.
they just can't.
Without some medical intervention. Yeah.
So it's great for those patients. For some patients, what you can do instead of having to excise all of the skin, if they have mild to moderate uh, excess skin, you can do some liposuction as well as skin tightening. And so it's not for everyone, but you can use this in the neck, you can use it in the arms and various body parts without having to do the big excisional procedures. But like I said, it's not for everyone. And I think one of the biggest game changers in the whole bariatric surgery, post bariatric patients is the weight loss medications. So
Okay.
patients who, once had to undergo the surgery, they can achieve similar weight loss with just taking the medications. And not only that, it can be more controlled. So instead of losing, 60 to 80% of your body weight in a period of, 3 months, it can be extended over a period of time where your body can adapt
Oh, that
better.
makes sense.
So that means less excess skin, maybe, potentially. Yeah.
Right,
Okay.
Right.
right.
Wow, that is interesting.
Okay, Dr. Jones, this is the part of the podcast where we ask you questions from our audience. It's called
Okay.
Ask the Expert, and obviously you're the expert. And here's the
All right,
first
let's
question.
do it. What's the first question?
Okay, how long after bariatric surgery should I wait before considering body contouring procedures?
So your weight needs to be stable for about 3 to 6 months. So stabilized weight, and then I would consider surgical options.
Okay. All right. This next question is, are there non-surgical options available for addressing loose skin after significant weight loss?
Yes.
Okay.
So I just mentioned the radio frequency.
Mm-hmm.
So there's several devices. I would say probably the most common devices that I use, one is called Renuvion, and the other is In-Mode Body Type. And basically, this is something that can be done in the office. You don't have to be asleep, you can be awake. And it's usually in combination with liposuction. And just keep in mind, not all patients are candidates for the non-invasive procedures. It really depends on the amount of laxity that they have. And this can be facial, it can be used in the neck, it can be used in the body as well.
And it's permanent.
Yes.
Wow. That's so interesting.
Yeah, basically what it does is it damages your collagen, causes your body to produce more collagen, which causes your skin to tighten up.
To tighten up.
Yes.
Wow.
Yeah.
There's so many things now.
All these advances in technology. Okay, this person wants to know, Dr. Jones, how do you determine which body contouring procedures will give me the best overall results?
Great question. So it just really depends on what their priority is, and obviously their overall health, and then the amount of skin laxity they have. Like patients who have mild to moderate skin laxity, they have more options. If you have a severe amount of skin laxity, you're probably going to need some sort of excisional procedure.
That makes sense. This person asks, what are the pros and cons of using weight loss medications like Ozempic or Wegovy after bariatric surgery, which we've kind of touched on. But
Yeah, I would say the pros, you don't have to have another surgery. And also, your weight loss can be more controlled. And it could be as simple as a shot. There's also pills, but I personally like the shots. Now, with the shots, anytime you're taking these medications, they have their own side effect profile. Most people don't experience that, but usually when you experience this within the first 3 days of taking the medication. So I would say the pro is it can be as simple as a shot. The downside of taking the medications are some patients need to take it for a really long time. Like you may have to take it,
your whole life.
Yeah.
So these procedures can be pretty costly. Are there ways that people can pay for them if insurance doesn't cover it?
There are financing options, and one of the financing options, your CareCredit credit card. And so basically, you fill out, you can get an application immediately, and they check your credit score. You find out if you approve immediately, and then so they have various options.
How does that help your patients, though, with the ability to have these procedures done that can be life-changing for them, having the CareCredit credit card as an option?
For the patient, it gives them a chance to address something that's been bothering them for, significantly long period of time, and they don't have to worry about paying it all up front. They're making an investment in themselves,
Yeah.
and they can pay it over a period of time.
They don't have the financial burden as much, but they
Yeah.
can still change their lives.
Absolutely.
Yeah.
Dr. Jones, is there anything that you would like to tell our audience about post-bariatric surgery or weight loss medication that we didn't ask you?
Yeah, so with the weight loss medication, I think it's very effective, but there are some things that you can do to enhance your results. So one, you need to make sure you stay hydrated, drink lots of water, and then really work on your diet. I think anyone who's trying to lose weight, in order to lose weight, you need to have a caloric deficit. So what does that mean? You need to either
Burn
burn
more than you
more.
take.
You need to burn more than you consume. And then what you eat is so important. I think for anyone who's losing weight, like the diet, I would say is like 90% of it. So um, less sodas, less juices, anything that comes in a can is probably bad for you.
Yeah.
Like stay away from um, processed foods. You want to eat more fresh fruit, fresh vegetables, less red meat, more seafood, more fish. Make sure you're getting enough sleep, and then also exercise. I think with the exercise and the weight loss, if you're just losing weight, more than likely you're gonna lose some muscle mass. And I think by maintaining the muscle mass, it gives your skin something, a foundation to kind of keep it tight.
That makes sense.
And then obviously you don't want to lose the weight very fast. If you lose weight like too fast, what's going to happen is you're going to have some uh, nutritional deficits, vitamin deficiencies. So you want to lose it over time. And I think that way you're less likely to have skin excess. But anytime you lose a significant amount of weight, you're at risk for having some loose skin.
Dr. Jones, thank you so much. This was so informative. We would love to have you come back and join us on Care
you.
Experts.
Yes.
Thank you.
Yeah.
Thank you so much.
All right, cool.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because with the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.